So liver tumors. Liver tumors, basically we need to understand whether the tumor is primary liver tumor or secondary liver tumor. So primary liver tumors are those which arise from the liver itself. That is the cells, the hepatocytes or the cholangiocytes, etc. They arise from the cells of the liver. Whereas secondary liver tumors are those which spread from other organs to the liver. So they are called as metastasis. Secondary liver tumors are different and primary liver tumors are different. The most common primary liver tumors are like hepatic adenomas, hepatocellular carcinomas, cholangiocarcinomas, biliary cyst adenomas, etc. So it is very important to differentiate these two because the treatment is completely different. So for a primary liver tumor, the approach is a curative approach. We try to cure the cancer. Whereas in secondary liver tumors, these tumors are advanced tumors, advanced cancers. Here, generally the cure is not possible. So we can only try to control the disease. So it is very important to distinguish between primary and secondary liver tumors. So how do we do this? So thorough history and a clinical examination followed by investigation. There are certain specific tumor markers for primary liver tumors. For example, alpha-fetoprotein. Alpha-fetoprotein, when it is elevated, it suggests it's a tumor, could be hepatocellular carcinoma. There are other tumor markers like CEA, CA99. These are the carcinoembryonic antigen and CA99. These are suggestive of tumors from elsewhere. The most important thing is clinical imaging. So we do certain tests called as endoscopy or colonoscopy. We search for tumors elsewhere, and imaging, cross-sectional imaging. The most important thing is a CT scan, a contrast enhanced CT scan, and in sometimes a MRI scan with or without contrast. So these tests will help to determine whether the tumor is arising from the liver or its secondary tumor. Sometimes it's very difficult to distinguish where the lesion or the tumor is arising from, whether it is a primary liver tumor or a secondary liver tumor. In those cases, we do something called as a biopsy, percutaneous biopsy of the tumor, and take a sample of the cells from the tumor and see under the microscope. So we do a thorough evaluation and see where the tumor is arising from, how the tumor looks under the microscope, and we do some special tests called immunohistochemistries. These tests, this immunohistochemistry and biopsy, help us to identify the nature of the tissue or the cell from which the tumor is arising. You need to understand where the tumor is arising from, primarily from the liver, or the tumor is coming from elsewhere, and the approach is the way I have described. And the approach to a liver tumor is very simple. Sometimes it can be difficult, and in those situations a biopsy is going to be helpful. My name is Dr. Dattaram. I'm a consultant surgical gastroenterologist and HPB surgeon practicing in Hyderabad. I specialize in tumors of the liver and pancreas. Anyone having problems with the liver tumors or pancreatic tumors can approach me. My secretary's number is 9895437059. You can share your reports and take my opinion. Thank you so much.